Welcome back. The Limpopo Health Department is calling on holidaymakers to be cautious against malaria during the summer rainy season. Certain parts of the province, particularly Vhembe District, Mopani District and Kruger National Park, have been identified as malaria transmission areas. The department is appealing to those visiting high-risk areas to test for malaria if they develop symptoms like headaches, body pains and fever. Let's speak to the Health MEC in the province, Dr. Phophi Ramathuba, who joins me now live from Polokwane. Thank you very much, MEC, for your time here on ENCA. Just firstly, tell me why this particular warning. Are you seeing a flare-up in cases?
Good afternoon to all your viewers. Yes, what we can indicate is that indeed this is the time where it is expected that from the month of September, October, November, you will see cases of malaria starting to be diagnosed at our clinics. And even now in December, we have started, especially in the low-lying areas. When you look at the northern parts of Vhembe District and the eastern part, your Madimbo area, Musina, and parts of Thulamela municipality. We also around the Mopani eastern part within the Mopani District, your Giani area, where also the Palabura area. So this is where some of the cases that we are diagnosing in our facilities are coming from. Hence, we felt it's important because Limpopo is one of those provinces that are tourism destination for not only South African, even our international guests, but to also indicate to them there's nothing to fear, especially if you look at Kruger National Park. What we do as a department, we've got a partnership with them where we have even trained the sprayers that stays there. So September, they had already started with the spraying within the Kruger National Park. Again, they will repeat just before Easter, somewhere around March next year. So we are confident that our tourists will visit the province and they will live without having been infected by malaria. But we can't rule out that there can be some of those with cases. Maybe I should also explain to your viewers why are we making this warning. It's because we know those who are not coming from malaria endemic area, when they visit our province and they go back home, 7 days later, they start to experience those symptoms. If they do not clarify their or explain to their physician, give them the traveling history. Most of the time, because malaria presents like many other infectious diseases, you might find that the physician will be doing lumbar puncture, doing all investigations, thinking it's meningitis, whereas it's malaria. By the time they diagnose malaria, you have already developed complications like cerebral malaria and death followed. So we are warning to say, if you have visited us, when you go home, please be careful. And when you visit a doctor, please explain your traveling history.
All right, so what would be the advice that you give to people who display these symptoms? What should they do first?
The important thing is to go to the nearest clinic or the nearest doctor where they can do malaria test, because it's important. Immediately after malaria will test positive, we'll be able to give you the treatment, and it's just the oral tablet for 5 days, it's cured. But we are also saying, before you travel, before you decide to visit those parts of Limpopo, and also some SADC countries, we know Mozambique, we know Zimbabwe, we know they also have got the similar challenges of malaria. If you are visiting some parts of KZN and also Mpumalanga, they also experience this malaria. So we're saying do some homework and try to check the areas you're visiting. Are they not declared malaria endemic by the WHO? And if that is the case, you can quickly go and get a malaria prophylaxis before you visit that area. In that way, you will protect yourself. But also, when you visit that area, you can also protect yourself. There are also mosquito repellents that you can find in your shops where you can buy. You can also use your aircon in the room or your fan, because malaria also because it's climate related. So what we are saying is that there are many other ways of protecting yourself from malaria. It is preventable, and there are also it's also curable. We can treat it provided you present early. But unfortunately, malaria can also kill if those two that I've mentioned are not followed.
All right, MEC, thank you very much for your time. Health MEC in the Limpopo province, Dr. Phophi Ramathuba.